Oh, hello. Happy Wednesday. I hope you are all doing incredibly well, whether you're catching this live or on the replay. So, as I mentioned earlier this week, today we are going to be doing a bit of a part two of a topic that we covered a couple of months ago. I think it was a couple of months ago. Honestly, what is time right now? I'm not sure exactly how long ago we did part one of this conversation, but the topic of conversation was, as you see at the bottom of the screen, how to get started with freelance health content writing, even if you don't have any prior experience. And in that conversation, I wanted to really give you all some tangible, actionable ways that you could start building that experience on your own, even if you haven't had that experience yet. Because as we all know, like whether we're talking about freelance health writing or we're talking about any kind of job or career, honestly, it's kind of this cyclical effect where you don't necessarily have experience. And so, but people want you to have experience to get an entry level role, but how do you get that experience without someone giving you a chance? And so it's that same cycle, honestly, when it comes to um, writing of any sort, and especially freelance health content writing. So the intent of the part one of the video was to give you some suggestions for ways that you could start to build that experience on your own. And in the comments, I left the link to that video so that if you missed it the first time around, you could go ahead and refresh yourself. So that link is in the comments if you want to listen to part one after you listen to this video. But to do a very, very quick recap, the suggestions that I provided in part one of this topic were to first and foremost learn how to write, because you do, if at least usually I'm talking to US based pharmacists and healthcare providers who are interested in health content writing. And so in the US, you are going to need to have at least a basic grasp of English as far as grammar and spelling go. That is kind of a baseline that I think is important to start at. And so if you're not extremely comfortable with English grammar, English spelling, that's like first and foremost is work on getting to that baseline. And then once you have that kind of covered, the suggestions I gave were to take advantage of opportunities that you might have in your workplace. So if there is a newsletter, that circulates between different departments, or there are other writing opportunities at work, take advantage of those. And then also look outside of your workplace in your community and in your environment. So if you have children and they go to a school, like, are there opportunities to write different types of materials at their school setting? If you attend church or a mosque or any type of religious or spiritual facility, or are a part of any religious or spiritual body, and there are opportunities right there. Just looking in your community for opportunities that you can find to write. And then lastly, getting creative in self-publishing. So let's say that you can't find any opportunities at work, or you can't find any opportunities in community. Create your own opportunities and go the self-publishing route. So some people choose to self-publish through a blog. Some people choose to, be active on social media and have kind of like a mini blog or micro blog through different social media accounts. You can do that in different ways, but basically you're thinking of the topics that you want to write about rather than waiting for someone to assign you those topics. And you're writing them and you're publishing them. That is the route that I took back in 2017. Before I got started freelance writing, I had started my own blog, which is how I found out that freelance content writing was even a thing to begin with. So the purpose of this video is because this part one of this topic was extremely popular, and I've gotten a lot of follow-up questions on the video and had some great conversations from it. And so I thought it would be helpful to revisit the topic to make sure that I'm sharing all of those conversations that I had been having kind of one-off with people who had follow-up questions, to make sure I'm providing that information to everyone who is interested in this topic. And so the key questions that I want to cover today are related to, like, how do you, so say you decide to go with option 4, right? You want to get creative and you want to self-publish, but how do you figure out what to actually write about? How do you figure out what topics or what ideas are good to write about? So that's what we're going to be talking about today. quick introduction in case this is your first time in one of these videos. I'm Megan Freeland. I'm a public health pharmacist turned health content strategist, and I run the Health Professionals to Health Writers program. So that's an accelerated program that helps pharmacists and other healthcare providers learn how to replace a portion of their income through freelance health content writing. And so we can go ahead and jump into these questions of like, how do you find out what to write about, what ideas, where to get ideas from? So first and foremost, let me say that ideas are everywhere. Like once you learn these strategies for thinking of content topics and ideas, you will be frustrated with yourself because you will not be able to turn your brain off. You will be finding and noticing content ideas in every single thing you do, which is a great thing if you're trying to be a writer, but honestly, it can also get a little bit annoying sometimes. There are three main questions that I recommend asking yourself in order to start to uncover the ideas that are around you. The first is, what are your loved ones asking you in real life? Your friends, your family members, the people you just kind of interact with on a regular basis. I know at least for me and a lot of my other friends who are health professionals, we might be the only ones in our family who are healthcare providers and who have medical expertise. And so because of that, we are getting a lot of questions about all kinds of things. If you know, you know, right? If you know, you know. So you might be getting questions about all kinds of things. All of those questions that are coming in are ideas of topics that you can write about, because chances are they're asking you questions that a lot of other people have as well. So if you're finding that like your parents are always hitting you up about their medications, or you have a cousin who calls you, once every 3 months with questions about their labs, or like anything like that, any trends and patterns that you notice in the questions that you're getting asked by the people who love and respect your expertise, use all of those as ideas. The next question that you can ask yourself is, okay, beyond your real life, your personal life, in your workplace, in your work setting, what drug information questions or just medical information questions do you encounter at work? So maybe if you're a pharmacist, maybe nurses or physicians are calling with this particular question often. Or maybe other groups in your workplace are calling with a specific question. What are the questions that they are asking, and what are other topics that might be related to those questions that might be helpful to write about? That's another source of ideas. If you work in a healthcare setting, you're literally surrounded by ideas about health topics, drug info topics, medical info topics every day. So of course, you don't want to cross any lines and talk about specific patient information and any of that stuff. What you're doing though is you're thinking about general topics that are important that people have questions about. This is another thing that I used when I initially built my portfolio. I had a pretty extensive history in like medical information and drug information. And so I had written plenty of memos in response to drug information questions. And I used pieces of those that didn't contain any like identifying information, whether for the patient or the facility, but I used that as evidence of like, hey, I can write. So that's another idea for where you can source ideas. And then the third recommendation is to ask yourself, what kinds of topics are you seeing discussed on other health websites, blogs, etc.? So it might be like you could go to your favorite news outlet or media outlet and go to their lifestyle or health section and see like what types of headlines are there, what types of articles are the journalists writing, what types of questions are people asking. You can go to, if you have like trade publications in your particular profession, so like a Pharmacy Today or a Fierce Healthcare or Doximity, and looking at the headlines and the topics of some of the articles that are being published there. Again, you're not there to like to copy and paste or to plagiarize or to completely take an idea. You're there to get inspiration, to say, oh, like this topic on this new clinical trial and how it affects heart failure or people with heart failure. That's interesting. Maybe people with heart failure have this particular question about that clinical trial. So you see how I'm not saying, oh, just go take that topic and write it. But it's like this kind of sparks ideas about what other types of topics you can be writing about. And so you can use these outlets, these publications, these blogs, these websites as inspiration to help spark ideas on your own behalf. So those are 3 questions that you can use to brainstorm, and will if you really like actually do the suggestions, they will lead you to endless ideas. Like you will just keep finding more and more and more. So again, to recap, that's what are your friends and loved ones asking you in real life? What types of questions are you encountering at work? And what types of topics are you seeing being discussed on different platforms? Now, I also want to add that another important element to consider is what if you are interested in becoming a freelance health content writer, right? What type of subject matter and materials, what type of content, what type of blog posts do you really want to be writing? And so another way of asking that is, what is your niche? What is your specific subject area that you want to be the go-to writer in? What niche do you want to carve out for yourself in the field of health content writing? It's kind of like, if you're not familiar with the concept of niching down, it's kind of like being a generalist in healthcare versus choosing a specialty, right? So that's kind of a similar difference. You can be a writer who writes about anything under the sun related to healthcare, or you can choose to specialize in a particular niche. And when I work with my students and health professionals to health writers, they're all going to specialize because there are major benefits to specializing. I'll touch on those benefits in a second, but the reason that I'm bringing this niche up is because if you already have an idea about what type of niche you want to carve your space in as a freelance health content writer, then it can be valuable to you to create a portfolio that is specific to that niche, right? And so if you choose to do that, if you choose to go the route of creating a portfolio or writing samples that are specific to that niche, then when you ask yourself the 3 questions that we just talked about, you're going to want to have that niche or that specialty area in mind, so that the ideas you're coming up with are specific to that niche. Okay. So I'll quickly talk about some of the benefits of a niche, because I know that when I initially bring up this concept, a lot of people, my students included, have resistance to the idea. I had resistance to the idea when I began health writing, because as a self-proclaimed multi-passionate person, I love variety. I love the interest of being able to kind of bounce back and forth between different specialty areas, different therapeutic areas. But I had to, in some ways, learn the hard way that niching down is not a bad thing and can really help to propel your career and trajectory as a freelance health content writer. And so for me, there's 3 core benefits of having a niche. You stand out from other writers pretty instantly, because the truth of the matter is a lot of health content writers don't have a niche. And in a lot of cases, that's on purpose. They don't want one, which is fine. That's your choice. But it helps you be able to kind of stand out from the crowd when you have an area of expertise that you can back up with samples, right? So it helps you stand out from other writers. The second benefit is that it makes you more memorable. Because I think it's easier to remember, oh, I had a conversation with someone who said they write for pharmacy consulting companies. Like, that's one of the niches that one of my students chose. It's much easier to remember that you had a conversation with someone who writes for pharmacy consulting companies than to just remember, oh, this person was a writer. Like, I don't know what they write about. They're just a writer. You know, that person who writes for pharmacy consulting companies is much more memorable in your mind, because there's a specific thing that sticks in your brain that refers to the way that they describe what they do. Whereas someone who's just a writer, I mean, you probably know plenty of writers. So it makes you more memorable. And the benefit of being more memorable is that you are more referable, because if someone remembers who you are and what you do, then when they in their daily lives encounter someone who might be in need of your services, they can more easily refer you. They encounter someone who runs a pharmacy consulting company and they're like, "Oh, I know exactly who you need if you're looking for a writer on your team. I know that this person is an expert in this particular field." They might know other writers, but they might not. But if there is someone who has clear expertise in in this area, then they're going to be more likely to refer that person to this specific person than any of those other writers. So having a niche makes you more memorable and therefore more referable. And then lastly, having a niche helps you increase your perception and your authority and your legitimacy as an expert in a particular area. Because if you, especially if you have a robust portfolio that supports the niche area that you're in, then that's really proof that you have a deeper knowledge of this particular topic than maybe another writer does. And so if a company specializes in this area, they're going to be more apt to work with someone who also specializes in this area as a writer. And when you have that perception and that authority as an expert, you can therefore command higher rates because of your expertise. Going back to the comparison between how this works for generalist healthcare providers and specialist healthcare providers, in a lot of cases, specialists are able to command higher salaries than generalists are, because of the nature of their expertise and the depth of their expertise. So it's kind of a similar concept when it comes to health content writing. So those are some of the core benefits of having a niche and choosing a niche. And again, if you do choose to create that niche, then as you are getting started and looking for experience and looking to create your own experience, having that niche in mind is going to be important, because then you can build a portfolio that serves as your evidence for that particular niche. So keep that in mind when you're thinking about these questions to help generate content ideas. As far as choosing a niche, you want to make sure that it's not something generic, right? You want it to be something tailored that you can really build your expertise in. So let me try to think of an example of like something that would be generic versus more specialized. So a generic niche would be like, if you are a freelance health content writer and you specialize in geriatric populations, right? Well, that is a level of niching down. You have niched a level because you have chosen a demographic of people that you write for. But you could also geriatric oncology content, or in, geriatric renal condition related content. You can take it a few levels further. So really think about like how specific you're trying to get when it comes to choosing a niche, if that's something that you choose to do. So again, in health professionals to health writers, my students, that is part of the process. Like, they cannot create their portfolio until they choose a niche. So it is a requirement, and I recommend it to everyone. Like, even, I'm going to tell y'all the real, even if you're not a student of mine. I'm going to share what I've learned in my personal experience, and in my personal experience, choosing a niche is definitely something that is critical if you are trying to really dive into freelance health content writing and to move forward with that in your professional trajectory. So keep those questions in mind as you're thinking of ideas to create content from and to self-publish. And again, if you have any questions, feel free to drop them here. Shoot me a DM as always. As a reminder, the wait list for the next cohort of health professionals to health writers is open. So if you want to join that wait list, the link is right here. And I will talk to you all next week. Have a good one.